Selena, you know where is Yu Wei?
I think she maybe，等一下，我也
Would
要
you
上
like to
线哦。
call her?
好，所以你现在没办法。好，好，OK，好了。啊，拜拜。She doesn't have the internet, so you can attend today's meeting.
Okay, so let's just get started now.
Yeah.
Okay, can you guys see my PowerPoint here?
Yes.
Okay, this is our schedule today. The team 3 will finish the presentation of the last meeting, and later on we will present the AI application of each team's the resource each team find. And at the next we will discuss how we combine our resource and what will the presentation looks like in September. And if teachers has any comment, just open microphone and speak in any time. Okay. Okay.
It's okay.
So
Take your time.
so the team 3, you can start your presentation of treatment and medication.
Can you hear my voice?
Yes.
I prepared the slide. Please wait a minute.
Okay.
Can you see the slide?
Yes.
Thank you. I will now present about lung cancer medication and treatment. The treatment of lung cancer is classified into 3 categories: surgery, radiation therapy, and drug therapy. First, I will present about lung cancer surgery. When cancer is in stage 1 or 2, surgery becomes the primary option. Surgery is categorized into 3 types based on the extent of lung removal. The first type is called the lobectomy, which is the most commonly performed surgery among the 3. The right lung is divided into upper, middle, and lower lobes, while the left lung is divided into upper and lower lobes. This surgery involves the removal of only the lobe where the cancer is located. The second surgery I will introduce is pneumonectomy. When the cancer is large or located at the center of the lung, the entire lung on the side is removed. The third surgery I will introduce is reduction surgery. When the cancer diameter is less than 2 centimeters, there is no lymph node metastasis, and the likelihood of metastasis is low. A small excision is performed only around the tumor. The advantage of this procedure is that it preserves lung function, and currently, it accounts for about 20% of lung cancer surgeries. Next, I will introduce 3 methods of surgery. The first is thoracoscopic surgeries. It involves making small incisions of about 3 to 4 places on the back and side and using a camera and surgical instrument inserted through those incisions. This method imposes less strain on the body and is commonly performed for early-stage cancer and elderly patients. The incisions are around 3 to 5 centimeters in length. The second method is open chest surgery. It involves making a larger incision between the ribs. This procedure is carried out in cases of advanced cancer or when the tumor is near major blood vessel. Requiring more complex interventions, the incision is around 8 to 10 centimeters, which has reduced the strain on the body. The third method is called hybrid BAT, video-assisted thoracic surgery. This is a relatively new surgical technique. It involves making an incision of about 5 to 8 centimeters near the armpit area and creating a smaller incision as well. A thoracoscopy is inserted through the smaller incision, allowing the surgeon to observe the internal area on the monitor. The advantage of this method is that it provides both monitor-assisted and direct visual observation. Although the incision is larger, the risk of bleeding is lower, making it a safer option. The above information covers the type of lung cancer surgery and surgical method, but there is an important point to consider. It's crucial to note that undergoing lung cancer surgery can lead to a decrease in respiratory function. Therefore, rehabilitation before and after surgery to engage the respiratory muscle and diaphragm is essential. Here is a reference. With that, I conclude the explanation about lung cancer surgery. Next.
Can you hear me?
Yes.
Okay, let's talk about radiation therapy. Radiation therapy for lung cancer can attack specific cancer cells, so it is less invasive and can be applied to any patient. Radiation therapy is also used to cure cancer and relieve pain. See the table below. Radiation therapy is mainly divided into these 3 types, and palliative treatment and preventive treatment can be performed to alleviate symptoms and prevent cancer recurrences. Radiation therapy alone or drug therapy and radiation therapy may be used for preventive treatment. Radiation therapy process. It is a flow of radiation therapy. First, gets a giant saw from a doctor, the patient's physical strength and age should be taken into account when planning treatment. Next, if it is decided to perform radiation therapy, CT imaging is performed in the same postures as when actually performing radiation therapy, and the positional relationship between the cancer and normal tissue is graphified. Based on these data, a precise treatment plan is created. A mark is made on the skin so that treatment plan is created. A mark is made on the skin so that radiation can be performed according to the treatment plan. Radiation irradiation uses the formed lineage of the radiological technologies. Radiation is delivered according to marks made on skin prior to treatment planning. No anesthesia required. Since the effect and side effects of radiation may appear, we will continue to follow up. A type of radiation therapy. It is divided into 4 main categories. It's hard to explain, so I made a table. In addition, there are various methods to enhance the effect of radiation therapy, such as ending irradiation in a short period of time to prevent cancer cells from growing, and enhancing the effect of radiation therapy with chemical therapy. Finally, let's talk about side effects. Side effects should be minimum in treatment. The following side effects may occur with radiation therapy for lung cancer. When formulating a treatment plan, the advantage and disadvantage of side effects should be carefully considered, and treatment should be carried out with an awareness of the patient's quality of life. Conclusion. Radiation therapy is a very good way to increase the patient's chance. We should maintain good communication with patients and provide medical care that brings mutual benefit. This is references. Can you hear my voice?
Yes.
Next, I will introduce drug therapy. Next, there are currently four types of drug therapies used to treat lung cancer. Next, first, chemotherapy. Second, molecular targeted drugs. Third, angiogenesis inhibitor. Four, immune checkpoint inhibitors. Next, first, chemotherapy. It is treatment using conventional anti-cancer drugs. It acts on the growth process in which cells divide and suppresses cancer cells. Next. There are currently it is mostly used in platinum preparation and other drugs, and treatment period is quoted for about a month. There are roughly 3 drugs used in chemotherapy. First, platinum preparation, for example, cisplatin, carboplatin. Second, metabolic antagonist, for example, pemetrexed, gemcitabine, third, microtubule inhibitors, for example, paclitaxel, docexel, vinolazine. Next, second, molecular targeted drugs. It is pinpoint specific genetic mutations that only cancer cells have. The side effects are small. There was a concern that conventional anti-cancer drugs would affect normal cells, but if we use this, we can attack only cancer cells. Next. Third, angiogenesis inhibitor. When cancer grows, new blood vessels are created to get nutrition, but the newly created blood vessels are not made, making cancer drugs that feed. Next. Fourth, immune checkpoint inhibitors, a drug that keeps the power of immunity to attack cancer cells. It acts on the antennas of T cells and cancer cells to prevent the immunity from being blocked. Next, it reference. Next.
Okay,
Thank you for listening.
thanks for team 3. Does team 1 have feedback?
No.
Okay, it's pretty excellent that you can finish this presentation because the treatment and medication contains a lot of knowledge of pharmacology and anatomy, physiology, and so on. And I've heard that you haven't finished this class yet, so it's incredible that you guys can finish this presentation. Okay, so the next part is the application of AI from each team. So let's start with team 1.
Can you hear my voice?
Yes.
And can watch my PPT slides?
Yes.
Okay.
Great.
And the next is introduction. And I find a research in 2021 at the ERS International Congress. And it used the AI program. Use AI program can spot the sign of the lung cancer on CT scan a year before. They can be diagnosed with the within existing methods. And lung cancer is the most common cause of the cancer death around the world each year. And it often diagnoses at the late stage when treatment is less likely success. So the researchers hope that using AI to support the lung cancer screening could make the process quickly and more efficient, and ultimately help diagnosis more patients at the early stage. And diagnosis is use the AI scan and CT scan, and CT is now is already used to spot the signs of the lung cancer, and it will follow by a biopsy or surgery to confirm whether the tumor is malignant. But each scan involve an expert radiologist, examining around the three imaging and looking for the site of cancer that can be very small. Therefore, radiologists have certain difficulty in reviewing each imaging because the long examination image can be exhausted and maybe lead to some error. And the research is training their AI program and using a set of CT scans from 888 patients. And the program was 97% effective in detecting cancer. And the result is the program also identifies too many suspicious areas that are not cancer. So this program needs to be greatly improved before it could be used in the clinic, because investigating all these would result in unnecessary biopsies, biopsies. And the object of this research is to assist the radiologists by giving them a tool that can spot the earlier sign of the lung cancer to help patients to be diagnosed and treated as early as possible. And this is my reference. Thank you.
Okay, thanks, Xiaohan. And uh, it's my turn. Okay.
Can I go first?
Yes, it's
Okay.
your time now.
Thank you. The best way to prevent and treat lung cancer is early diagnosis, which can not only prevent the spread of cancer cells but also improve the quality of life and survival rate of patients. However, the difficulty in the early diagnosis of lung cancer is that the symptoms are not obvious. Most of the late stage is quite serious, or the cancer cells have already metastasized. when the body has abnormal symptoms. Patients with lung cancer have the best survival rate if they are diagnosed early and receive treatment. Although low-dose computed tomography is called LDCT is more effective in detecting lung cancer than traditional chest X-ray plus SUPEM tests. It can reduce the mortality of lung cancer patients is as high as 20% to 43%. But there are problems such as high cost, high radiation exposure, those in long-term tracking, insufficient accuracy, and overdiagnosis. The research team of Google Health Research in California found that computer artificial intelligence can interpret computerized tomography, scan images to assist doctors in diagnosing early lung cancer. The initial test effect is very good, and the accuracy rate is comparable to that of radiologists. And the research team used computer deep learning algorithms to analyze more than 42,000 low-dose computed tomography images in the electronic database of Northwestern University Hospital in Chicago. This smart neural network system will operate and respond according to a series of instructions, and then they give the computer to analyze the tomographic images of many patients. The images include original CT images and early CT images. These patients are all has been diagnosed. Some of them suffer from lung cancer, some do not have lung cancer, and some were originally tumors that later deteriorated into lung cancer. Early computed tomography of the lungs is very useful and can show whether the tumor growth rate is abnormal, which can be judged as a malignant tumor. After the judgment is completed, this automatic image evaluation system can judge whether the patient suffers from lung cancer from the provided images without human assistance. Help me to change the next page, please. Okay, so why this system is so smart? The reason is this simulated human neural network system usually reviews hundreds of plain CT images of the lungs, while the computer automatic evaluation system checks a large number of three-dimensional tomographic images, which requires a lot of computer calculations. It is easier for a computer to detect early lung cancer through three-dimensional images than through two-dimensional images. So coupled with two images at different time points, it has reached to the 4D level. Computer deep learning technology makes the diagnosis of early lung cancer more accurate and can also do a better job of classifying specific lesions. So it can not only diagnose cancer patients, but also help people without cancer escape and expensive and risky invasive lung cancer tests. Okay.
Okay. Thanks for Yiru. And next is my part, and I'm going to talk about the ethical dilemma of AI application in not not only in lung cancer but in many area of medical field. And the reason I picked this topic is, in fact, AI can be applied in any period of a disease, like starting from the diagnosis and the process of curing the disease. And in the late period, the patient is close to death in a maybe hospice period. And because I'm a nursing student, so I was thinking about applying AI in the pediatric care period, because in the pediatric care period, we aims to make the patient comfortable more than cure the disease itself. And so I find some AI application in pediatric care. So I find this paper in the left side. It used ChatGPT to simulate some pediatric care dilemma situation and let expert to discuss about it. And then I find out there is some problem in applying AI to pediatric care, because can AI decide a man is going to death or not? So I find the paper in the right side, and that is the paper I'm mainly going to talk about later. I'll give you a situation. If a doctor tell you that you are diagnosed with lung cancer, but he cannot tell you the exactly reason why you are diagnosed, is it acceptable for you? And you can answer this question in your heart. And here's the next question. If after the AI read your X-ray of your chest and it tells you that you are diagnosed with lung cancer, but he cannot tell you the exactly reason, is it acceptable for you? And you can answer this question again in your heart. And this paper, in this paper, they trained a AI model. They give the AI model some chest image and some database, like the patient's BMI, the patient's body mass, and so on, and train the AI to tell the patient is a black or white. And as a result, the accuracy of the AI telling the man's race is high up to 90%. So the scientists try to remove those those database like the age, BMI, body mass, and they even cut the image into pieces and give this information to the AI model again. And the AI still can read, still can identify the patient is a black or white. And you can see these pictures in the left downside. They even remake the picture to unclear the picture's image. The AI still can identify the patient's race. And here's the problem. What if an AI diagnose your lung cancer by your race? One of the reason AI diagnose your lung cancer is your race. And here is the five ethical principle of AI application in medical field. And in this case, the AI violate these two principles. First is justice. If you walk in a clinic and a doctor see, oh, you are Asian, you are black, and then he have some chronic thinking about your disease, Is it fair? And the next is explicable capability. It means the way how AI works needs to be explainable. If it's not explainable, then it cannot be applied to human. And you can see that the scientists try to figure out which information that AI used to identify the race. But as a result, those scientists cannot figure out how AI identify the race. So this application is unexplainable, and then it violates the explicable capability. So in conclusion, it's just a simple AI model that made by a big database, and it just used for identifying race. But you know, the AI is more and more complicated now, and there are many techniques like human neural network and so on. And these techniques are not understood by human totally. So when we are trying to apply an AI to medical field, we have to figure out it is just convenient for our medical staff, or is truly fair enough to the patients. And here's my brief introduce to the one of the ethical dilemma case of AI application. And here's my reference. The second and the third is there are some interesting case of ethical dilemma. If you guys have times, you can go search these two papers. They are all free in the internet. So you just you just type in the topics and you will find a paper. Thank you. Okay. Uh, the team three ready? If you are ready, you can go on. Okay, thank you. I see your slides.
Okay. We will now present how AI can be used to treat lung cancer. The way I envision AI being utilized is for suggesting treatment methods and medications. There is an enormous amount of data from lung cancer patients available. Collecting this data and feeding it to AI, it will perform analysis. It will analyze various information such as patients' symptoms, lifestyles, medical histories, and more. And AI will suggest treatment methods and medications. It can identify personalized treatment approaches for each individual patient, offering the advantage of potentially discovering new treatment methods as well. Here is my reference. Next,
Can you hear me?
Yes.
Okay. It's about AI patient monitoring. I believe that monitoring patients with AI will lead to improved patient care. Look at the picture below. This is a machine that can easily know the patient's blood pressure and pulse. By using this, an alarm will sound when an incident occurs, and you can call a nurse and know at a glance what action to take. However, malfunctions can interrupt patient care and lead to a loss of confidence in the alarm. Therefore, it is necessary to make improvements such as sounding the alarm only for the minimum necessary parts and sending notification to the nursing computer for the other parts. Next is monitoring of the patient room. Surveillances. These cameras allow you to monitor patients 24 hours a day, which can be useful when you are watching critically ill patients. However, there is a danger that privacy will be lost by attaching a surveillance camera. Therefore, it is essential to obtain the permission of the patient when installing a surveillance camera and to install it in a place that meets the purpose. Patients and medical professionals can communicate well with each other, confirm for what purpose the AI will be used, and thirdly, confirm the advantage and disadvantage of AI and use it to lead to better medical care, I think. This is references. Thank you. Can you hear my voice?
Yes.
Okay. Finally, the development of drug. Currently, there are various challenges in the development of drugs. For example, how to shorten the time of new drug development. How can we increase the probability of success? And how to reduce the cost of new drug development. Let's use AI to solve such problems. I will give an example of the possibility of AI in the development of drug. Drug candidate molecule discovery and evaluation of drug efficacy and safety by pathological image analysis and harmonic prediction and paper search using natural language processing can be considered. References. In this way, AI will help solve the problem that drug development currently has. This concludes our presentation. Thank you for listening.
Okay. Thank you. So, uh, our representation of AI application are all finished. And I want to say that the AI applying in drug development is one of the interesting part of AI application because my mom's company, they use computer to simulate the molecule structures and to see how it works with the specific target on the cancer gene. So it is also an interesting part. I like it. And next we are going to do is we are going to discuss how we going to present these information we collect in these 4 meetings together to present on September. Okay. So in that day we got 20 minutes of our presentation, and there are 5 minutes of discussions that the audience and teachers will ask us some questions or discuss some problems with us. And we have to discuss right now we have to discuss what we are going to present in these 20 minutes. Okay, so do you guys have any ideas which topics we should pick to present in the in September? You can open your microphone to speak, or you can type your opinion in the chat room. Any opinion? Okay. My opinion is that day we can start from simple pathology of lung cancer because not everybody know about lung cancer as us because since we have already do some research about lung cancer, then we can discuss in every period's lung cancer's application, and we can um uh, present how it used right now and the perspective of the AI application and what problems will we encounter, for example, ethical dilemma in the future perspective. Any else opinion? Okay. If you think the concept I just said is okay to present on September, please raise your hand. Can you guys hear my voice?
Sorry, I want you to say it again.
Okay, it's fine. You can talk. You can if you guys can talk or you didn't hear clear, you can type in the chat room and I will explain again. We can introduce a simple pathology of lung cancer in that day because we have done some research of lung cancer, so we know about lung cancer, but other guys in the class don't know that much about lung cancer, so we can introduce pathology of lung cancer first. Pathology. And after introducing what is lung cancer, we can go into the topics that how it apply into the lung cancer in currently. Okay, so application currently. And the application currently is what have been done or what is doing. So we have to figure out what is the perspective of the application. And what problems will encounter in the future. Okay, and I type it in the chat room. Do you guys think it's okay? If it's okay, then raise your hand. Is it okay? Can you guys, do you guys hear clearly?
Hi, every student. Can you give me the reaction to our leader Deng Yu? Thank you.
If you don't reply me, I'm going to call your names and force you guys to reply me. Quickly. If it's okay, raise your hand. Okay, I see Xiaohan agree of my opinion. And I see Yiru. Okay. I see everybody raising their hand. Then, okay, you can put your hands down. Okay, so if you have any other ideas, you can uh, uh, if you have any more ideas, you can just speak it into the line or type it into the chat room or just open your microphone right now, okay? That will be fine. Okay, so we're going to talk about these 4 topics on September. And next is how do we divide the time? Because we got only 20 minutes and sorry, give me a second. We've got only 20 minutes and we have to finish these 4 topics, right? So how do you guys think we can arrange the time? I'm going to call somebody to ask their opinion. 小韩
Hi.
Hi. How do you think we can arrange the time?
I think preference can let less time in all.
Oh, I see Iru. Iru says the introduce of methodology costs 7 millions and application currently costs 7 millions and perspective and problem costs 3 million for each. I think it's a pretty good idea. Any other ideas? This is pretty important to introduce lung cancer to the audience. So I think it's worthy for 7 millions. And the application is our main topic, so it's also worthy for 7 millions. Any other opinions?
Sorry, Deng because
Yes.
I think because this topic is the AI for lung cancer application, so I think the focus is on the AI application, and the presentation on the introduction of the lung cancer, I think maybe should be the
Like
less than 5 minutes.
okay,
It's
like
enough.
3
Yes,
to 4 millions, right?
yes, yes.
Okay.
Thank you.
It's also so if we cut down the time of lung cancer, then I think it would be like 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 this or maybe like this. Is it totally 20? Oh, okay. I know where is the problem. Sorry, guys. Or it's also okay for the 4-10-3-3. So then we got okay. If this is okay, thumbs up on this message. Yeah. Yeah, I see Koga-san is typing. Let's give her a second. Oh, the number is how long the part in the presentation will take place. Like we got 20 minutes in September, right? And that's the time, the total time we have to present our topics. And we are going to present these 4 parts: pathology, application currently, perspective, and problems. And we are going to present pathology for 4 minutes, and application for 10 minutes, and perspective for 3 minutes, problems for 3 minutes. Then it will be totally 20 minutes on that day. The day you come to Taiwan. Understand? I can explain again.
Yes, thank you.
Okay. So, if it's all, I see everybody thumbs up already. So then we're going to separate the part like this, okay? Then what we are going to do is we're going to divide the work. In the in the meetings of the previous 2 times, we divide into 3 teams, right? But now we have new different topics, and these topics are all presented in different time span. So we're going to have a new work divide, okay? That means we got new teams, right? So do you guys have any idea how can we divide our team? Okay, I think because most of the Japanese classmates are first year in the college, so they haven't finished some of the medical class yet, right? Am I right? Classmate from Japan. You haven't finished like pharmacology or anatomy or physiology, right? So I think this time we can divide into uh, 1 Taiwan students with 1 Japan student. Do you guys think it's okay? If it's okay, raise your hand, please. Thank you. Okay, I see Yamabe-san raise her hands very quickly. Okay. Okay, so do you guys want to pick your own partner, or pick the partner by computers? Or the other option is that we can just separate by our own apartment. Nursing students with nursing students and MR students with MR students. Which one do you prefer? You can open your microphone and tell me your opinion. Does Iru want to talk because I see your hand raising? Okay, you put your hands down. You don't want to talk to me. All right. That's fine. Okay. So do you guys want to pick up randomly by computer or pick up your partner by yourself? Which one do you like? Or you would like to or would you like to co-work with the guy with the same apartment as you, like Team NT, Team MR, Team Nursing? This is the choice one. Okay, here is three choice. Can you guys see what's the three choice? Choice one, divide the team by your apartment. Choice two, okay, I will use the computer to pick up your partner randomly. Choice three, you pick by yourself. Which choice you want? Please type in the chat room. Start now. Let's go. Okay. Okay, can I get some water? I'm a little bit thirsty. Okay. During I taking my water, please type your choice. Thank you. Okay, I see. See. One. Okay. Divided by. Okay, there's more than half people pick the first choice. So we're going to divide our team by your own apartment, okay? So let's see. Iru, you are going to co-work with Koga-san, okay? And Selena and Yu Wei, but Yu Wei is not here today. We're going to co-work with Kinoshita-san, okay? And I'm going to co-work with Yamabe-san, okay? So you guys know your own partner, and you can contact each others by line, or other you can decide by yourself, and you can chat, talk to each other in daily life to know each other better, okay? For discussion, because you are going to work together. And the students from Changgen are they are all more than second grade, so please lead students from Japan to finish the presentations, okay? Because you have finished some professional course already, okay? Taiwan student, okay? Okay, you all the Taiwan student, you guys okay? Can you guys lead them? Okay, I see you says okay, then it's okay. Okay. Oh my god. So we got methodology for 4 minutes, application currently for 10 minutes, and perspective and problems for 3 minutes. And my opinion is to divide the application into 2 minutes and 8 minutes, and maybe 3 minutes and 7 minutes, and part of application currently are going to share to the methodology team. Sorry, it's the wrong version. Give me a second. Give me a second. Like this. So the first team will be 7 minutes in total, and the second will be 7 minutes in total, and the third will be 6 minutes in total. Is it okay? Is it okay? Is it okay? Please, I want a heart of this to this message. If it's okay, give me the heart. Give me a big heart, please. Thank you. No, no. You give me the wrong. You give me the thumb. I want the heart. Okay, teacher is typing. And other classmates, do you think it's okay? Okay, I see some hearts. Okay. So, do you want to pick your part by yourself, or you would like to pick the part by computer? I will click that. If you want to pick it randomly, I will click later in lecture room later. Okay, Yiru says computer. Any other opinion? Okay, then I will click the later in the lecture room later on. So, we have already finished the introduce of lung cancer and application of AI previously. So the next time is the new team, which is Team MR, Team MT, and Team Nursing, are going to make a slice or no, I'm going to open the slice and we're going to work on the same slice and we're going to present the first version of our final presentation. Okay, the next meeting. I will pick a beautiful slide frame for you to use and we can combine our works together. Okay. Any problem? If no, that's our meeting today. Does teacher have any other things to remind us?
Okay, so I would like to first thank you, Daniel, for his leading our team for discussion with this AI topic. And here, I would like to briefly comment your students' presentation. And the first is Xiaohan. And you have a good performance to presentation, and you use clear image to show how to use the AI for CT image analysis. But I think you, if next time you do a same topic presentation, you can explain more detailed method approach to how to use this AI to help the CT image analysis. And next is Yiru. You provide a lot of information for AI application for the X-ray image analysis. You talk about the system can help the this image analysis. But I find your slide there is so few slides in your presentation. So remember when you present your topic more content, you maybe increase your slide page. And the next is Dengyu. Dengyu, you also have a good presentation, and you use very many specific case reports. So you not only depend our audience, so our students understanding of this AI application, but also highlight the diversity of the this AI application. So it's very good, and keep going. And for our students, although you are a freshman, first year undergraduate student, but I think you can present more better. So maybe you can find a more real application in Japan for AI application for this lung cancer. So it will improve your presentation. So okay, so I think every student have a good presentation in today. So I hope you can improve and practice your presentation, and let's work in our topic. So this is my today's briefly comment. So is anyone have any problem? Can you raise a hand? Okay, if no, so today's discussion is finished. So thank you every student.
Okay, so I will type what's going to do next meeting in the lecture room data and pick your topics data. And teacher, don't forget to send me the link.
Oh, okay. Thank you.
Okay, thank
for
you.
your reminder.
Okay, goodbye.
Okay, thank you. Bye bye.